Okay, thank you, Madam Chair. And again, thanks to the secretaries for being here to talk about the intersection of healthcare and education, something that's near and dear to so many of us. If we talk about the highest causes of death for your students, for our students, it's accidents or trauma. Suicide is number 2. Homicide is number 3. Cancer might be going up or down depending which age group we're talking about. But focusing this morning for me is on the emotional health and the impact on the suicide rates from COVID as well as our policies. That's what I want to focus on today, and especially what our mandates do to the emotional health of our children. I turn to the conversation of natural immunity just for a second. Look, I've seen the data. All the moms out there have seen the data on natural immunity. And I'm telling you, these mama bears are going to protect their kids. They don't see the benefit of a vaccine for something their children are already immune to. And there are risks associated with the vaccine. And don't get me wrong, I've had the vaccine, my parents the vaccine. I hope my parents get their booster soon. I'm in favor of vaccines. But when we're talking about our children and those ones that already have immunity, I think that many Americans have concern about this and the emotional impact if those kids get kicked out of school because of this mandate. I think you both would acknowledge that getting kicked out of school has a huge stigma to it. And if this is my question for you both, yes or no? If the CDC would acknowledge natural immunity and a child has antibodies, would you consider excluding them from the mandate? Let me say that again. If the CDC would acknowledge natural immunity and a child has antibodies, would you consider excluding the child from the mandate? Secretary Cardona, yes or no?
Thank you, Senator. This issue requires more than a yes or a no. I know states and local districts are the ones making decisions around masks and vaccines, and I'll rely on them. What I've done, because I'm not a medical doctor, is rely very heavily.
And that's what my question
guidance.
is. So if the CDC acknowledge it and a child has antibodies, would you support excluding that child from the mandate? Think of the emotional impact of that child being kicked out of school for something they're already immune to and the suicide rate. Secretary Becerra, can you answer the question, yes or no?
Senator, you'll be disappointed, Senator, to know that you're going to be disappointed, Senator. I was about to say you're going to be disappointed to know that it's not a yes or no answer because science doesn't act as quickly as you'd like on those answers. What I can tell you is that we have looked at the science, we have looked at some of the studies and the data, and for example, in the state of Kentucky, with regard to children, there was a study that showed that for those, actually individuals, not just children, people who were unvaxxed, who had COVID, showed that they were twice as likely to be reinfected with COVID than those who had been vaccinated.
Yeah, so we can argue about the studies all day, and I'm a physician, you're a lawyer, and you probably don't want to go down that road. Because I'm telling you, the huge majority of the studies show that natural immunity is better than the vaccinations. A huge majority, and let's don't talk just about getting the virus, let's talk about hospitalization, about morbidity and mortality. And your jobs, neither of your jobs is to decide what, if the statement is true that I'm saying, that natural immunity is better. That's up to the CDC. So my question was, if the CDC would acknowledge it and a child has antibodies, would you excuse them from the mandate? But we need to go on. I'm very concerned about migrants coming across the border carrying infectious diseases as well. Probably over 3 million migrants have come across the border illegally, legally, and many of which are children. I'm very concerned about not just the COVID and the variants they're bringing, but tuberculosis. Haiti has the highest incidence of tuberculosis in the Western Hemisphere. Measles, mumps as well. And what are you two going to do to A, to test those children before they get into our schools, and B, to make sure that they get their immunization? Secretary Becerra.
Senator, great question. And we do, as you know, have jurisdiction over some of those migrant children who are unaccompanied. And we have jurisdiction over them once they're turned over to us by Customs and Border Protection. We make sure that no child is placed in any setting whether it's in our congregate care or in a licensed care facility or in the hands of a responsible custodian, without first making sure that they are free of COVID and they've had a vaccination. And so we make sure that no one, whether it's a U.S. citizen or anyone coming into this country, can infect someone else.
And I'm sure you're measuring that somehow, some way. Secretary Cardona, anything to add to students entering to our school systems that have not been tested or properly immunized?
All students, including non-citizen students, have access to meals, to education, and any healthcare needs that they have to make sure that they're healthy.
But there's a huge difference between access and it actually happening, right? I mean, we have to be just overwhelmed right now, our systems do, our schools do, with these children. 12,000 Haitians recently have been turned into the United States, and I want to share compassion and love with those folks. I've done mission work in Haiti. I've been to the border. I understand the humanity of all this, but I also don't want my grandchildren exposed to tuberculosis, let alone new variants of COVID.
Madam
Thank
Chair,
you,
if I
Madam
could-
Chair, and I yield back.
Thank you.